For those who don't know, I've been dealing with gynecomastia conditions for over 20 years now. And as such, obviously, I've created a team around me which helps to support not only the pre-op but the post-op care. And of course, Mark is part of this team because he's an experienced plastic surgeon who similarly has been treating gynecomastia patients for a number of years. And we both see eye to eye in terms of how we feel patients want to look afterwards. And that's why he's a very important part of my team here.
I've been doing this for a long time, and I have peer-reviewed publications on it. I've also dabbled on a television show dealing with this particular conditions. And what I found also myself is that as I evolve my technique in improving and looking after patient, my whole system seems to be approaching more and more towards the way you're looking at it. And that's why I feel that together we're going to work well.
There's an excess amount of fat and an excess amount of gland. And unless you deal with both of those components effectively, you're still going to be left with some gynecomastia there. So I tell them there's going to be two treatments done at the same time. We're going to do some liposuction to remove the fatty component, and then obviously we deal with the glandular component. Would you agree with that by and large?
I totally agree with you on this, Alex. As this condition is known as the male breast, its composition exactly the same as the female breast, where it's actually got fatty tissue and glandular tissue. You cannot simply remove one component and not the other and expect to have a good outcome and a good aesthetic appearance.
There's no specific underlying reason behind the development of gynecomastia. It's usually caused due to genetic predisposition to having this condition. However, in a small percentage of patients, there are other causes, aren't there, Mark?
Yeah, only a very minority group has underlying causes. For example, you can have medication that is prescribed by doctors like ranitidine. They've been known to cause gynecomastia. Some recreational drugs like marijuana for long-term use, you can cause that problem. Obviously, there are also health issues such as liver diseases, testicular diseases, but as a doctor, we always make sure there's no association before we're going to go surgical treatment.
That's correct, Mark. But of course, the other thing we must bear in mind is a lot of patients these days take anabolic steroids to enhance, improve their body. But unfortunately, one of the side effects is the development of gynecomastia. So we need to ask these kind of questions to patients, see whether there are on any specific drugs which may cause gynecomastia as a side effect.
Well, in my personal opinion, this is a condition that needs surgery and nothing else. However, there are doctors that will prescribe hormonal modulation medications to try to stop the hormonal changes that induce gynecomastia. However, I think that in most cases, when you terminate the medication, the condition recurs, and also there is always some side effect associated with medications.
And also, I think it's questionable how much of an effect you actually get with these. I think it's a pretty small, not particularly discernible difference.
Surgical technique is the most important thing in treating this condition. But I think in this particular case, you and I both can see that the support we have to give patients to walk through that journey is very important. And I think that makes a lot of difference to the patients.
Well, I think that's absolutely true. And the fact that, of course, we treat so many patients, we understand, I think, their condition, their situations, even if you like, their psychology behind why they're having it done. So I think we're in a better position to be able to offer them the support they needed throughout this journey. I think it's really important that I explain to patients that I want them back into their normal day-to-day life very quickly afterwards. That means they can go back to an office-based job within 2-3 days. And likewise, if they're into fitness and they like going to the gym, usually about 2.5 to 3 weeks, they should be able to get back to their normal regime.